Hello and welcome to the Tower Expansion Celebration at CoxHealth. I'm Yvette Williams. We're so excited to unveil the new Jared Neuroscience Center, which brings neurology, neurosurgery, physical medicine and rehabilitation, specialty clinics, and inpatient care together in one facility.
Neurology encompasses everything that is the brain and the nerves. From the tips of your fingers to the center of your brain, and everything that we think and do is controlled by the brain. So it's actually a very wide-reaching specialty and very diverse.
Now that we're coming together at the Jared Neuroscience Center, we're bringing the disciplines of neurosurgery, neurology, neurocognitive specialists, the physiatrists that are all working towards making the diagnosis and treatment of the neurologic patient a little bit easier.
The new center brings together multiple specialties, each with a unique perspective in treating a disorder, and we're in a close proximity to better meet a patient's need.
It means a number of things: the best quality that we can bring, the most services in an efficient way. It allows our patients to move around within a relatively small confine. Rather than traveling across town or returning for multiple visits, we can plan a day that really brings some quality care to a patient because it's all in immediate proximity here.
I'm excited about the collaboration between the physicians and just a better group identity as neurosciences. I think that's going to be great services for our patients and really exciting. We're entering a new era.
We're a community-based hospital that is bringing back to its community better health care.
I shook all the time.
64-year-old Steve Lehman experienced tremors most of his life.
I contacted Dr. Wong. He thought I was a good candidate for the DBS surgery.
Well, deep brain stimulation is a procedure where we place a fine wire attached to a pacemaker into a small part of the brain. By adjusting this device, we're able to block the abnormal signals that cause tremor.
Once the neurostimulator was turned on, Steve saw immediate results.
My tremor just immediately stopped. I could actually take a drink without spilling it, and it has made my life so much better because now I don't fear doing the things that I had come to just kind of avoid or would not do because of the tremor. It has been life-changing.
To hear more of Steve's story and learn about advanced neuroscience conditions and procedures, please visit coxhealth.com.
We're really proud of our multidisciplinary approach, which means that we're bringing together physician, nurse, social worker, the physical therapist, speech therapist, occupational therapist in one setting where the patient can be the focus, and we can design a treatment plan for them that isn't just medication related. And so that is a unique thing that we are bringing to patients with Parkinson's disease and other movement disorders.
Deep brain stimulation is a surgical treatment for movement disorders, namely Parkinson's disease and essential tremor, where the surgeon can place electrodes deep inside of the brain that are connected to a battery similar to a pacemaker. And that basically allows the surgical team, in conjunction with the neurology team, to eliminate tremors and some of the movement disorders associated with Parkinson's disease.
When I finished neurology in training, I thought, well, this is the way it's going to be, but that's not the case. I mean, in the 25 years that I've practiced here, I've seen a lot of change, so I think it's an exciting thing to see, and I think it's going to bring a lot better health care for those patients that are affected with neurologic disease of all kinds.
My name is Steve Lehman. I'm 64. I'm a database developer for the Branson Tourism Center. For most of my life, since I was in high school, I've had a tremor. I shook all the time, and in the latter, say the last 10, 12 years, it's really gotten quite a bit worse. They diagnosed it about 5 years ago, and up until that time, I just thought I was really shaky or had Parkinson's or something like that. I contacted Dr. Wong, and he thought I was a good candidate for the DBS surgery. I was diagnosed with essential tremor. It's hereditary, for one thing. My father had it. I remember my father having a horrible time with it. Say 20 years ago, it wasn't really bothersome. I could sign my name pretty well and write so I could read it. But in the past 5-10 years, it's gotten so I couldn't even sign my name or write so I could read it. I think at its worst, one time my wife and I were out celebrating, and we were with another couple, and we went to do a toast. And when I raised my glass, first all the champagne spilled out of it, but when I touched their glass, my glass broke because I was shaking so much. And for the most part, people who knew me, they accepted it and kind of helped me. I think I was very self-conscious of it. Would realize right off that I had, affliction of some sort. And I had this procedure done twice because they do it for each side. And it's DBS, or deep brain stimulation. And the surgeon was Dr. Mace. And essentially what they do is implant an electrode into my brain, and a wire connects it to a sending unit, which is in my chest. And it sends a constant current. On my left side, it sends 1.6 volts, and my right side sends 2.6 volts. And I can adjust that amount. If I'm extremely nervous, I can turn myself up, or if I'm kind of calm for the day, I can turn it down. I'll never forget it because my wife and I were in with Dr. Wong. When he turned me on, sounds funny, but when the doctor turned me on, and my tremor just immediately stopped. And he had me take a drink, and he had me draw some circles on a piece of paper. And he had me do it before, and then he had me do it after he turned me on. And the difference was night and day. I mean, for the first time in years, I could actually take a drink or hold a cup out away from my body without spilling it. And it was fantastic. Every day I find a new way where it has changed my life. There were so many things that I just would not do because of the tremor. My wife really appreciates the surgery because she doesn't have to feed me, which she had to do from time to time. She doesn't have to watch over me. I couldn't, there were times that I could not feed myself, and if I took a drink, I would spill it all over me. It has made my life so much better because now I don't fear doing the things that I had come to just kind of avoid or would not do because of the tremor. I'm much more independent. I'm just like everybody else now. At work, because everybody knew I had this. And of course, they knew that I was having the surgery. And now they all see me with calm hands. And it has been life-changing.
We finally have brought all the different parties together to incorporate really the region's only neuroscience center, where all the different physicians can come under one name, one roof, and have one kind of common mission statement.
The new features of Jared Neuroscience building include epilepsy monitoring unit, that specialize in inpatient monitoring of epilepsy.
In the specialty of neurology, we treat patients with medical ailments pertaining to the nervous system.
Migraine headaches and Alzheimer's disease, multiple sclerosis,
Epilepsy, Alzheimer's disease, ALS, amyotrophic lateral sclerosis is a disease of the central nervous system and muscle. The motor neurons degenerate for reasons that are somewhat enigmatic in medical science. But with that neurodegeneration comes a progressive wasting and weakness of muscles, and we treat the symptoms as well as altering the course of the disease with modern medications.
One of the really exciting things is that we received a large grant to open an ALS clinic. And so this will be a multidisciplinary clinic that will involve physical therapy, occupational therapy, speech therapy, social services, as well as a neurologist, obviously, in coordinating the care for the ALS patient throughout the stages of their disease.
I started getting really dizzy.
Mary was just 5 weeks pregnant when she had a life-threatening stroke.
She had a brainstem stroke. This is the worst possible kind of stroke where people are locked in and can only control eye movements and require life support forever.
Well, I've known Mary for many years, and it was really tough to get that call.
The clot-busting drug TPA was Mary's best hope for recovery.
I was more scared with Mary than I was with almost any other stroke patient that I've seen, and I've seen a lot.
The clot-busting drug worked. Mary had a full recovery.
Mary was seen very frequently by myself and our high-risk OB doctors.
8 months later, Nora was born.
Who I say is my miracle child because she came through it. It was the best day of my life.
Stroke is either it's loss of oxygen to part of the brain, whether that's from too much blood in the form of a bleed, or the more common kind, which is not enough blood because a clot or a blockage has occurred. But when the brain doesn't get the oxygen it needs, it can't function. So we see that in special patterns that we recognize and try to determine what kind of appropriate care they need.
Our new facility allows the stroke center to operate more efficiently. We have more space to have more timely access for us from our offices upstairs to our inpatients directly below us, for me to attend to emergent stroke situations very quickly and provide a higher level of care.
I am a preschool teacher. I was teaching my 3- and 4-year-olds at work, and I can remember texting my husband at 8 o'clock in the morning saying, I feel a little dizzy.
Mary Cashmore was just 5 weeks into her pregnancy when she experienced a serious stroke.
I was scared to death because I thought something was wrong with the baby. You know, I would have never even thought in the slightest that I was having a stroke.
Mary's family knew she needed immediate medical attention. They took her to CoxHealth.
Mary was non-responsive. I could tell that we were close. She almost died.
She had a brainstem stroke. This is the worst possible kind of stroke where people are locked in and can only control eye movements and require life support forever.
I've known Mary for years, and it was really tough to get that call.
The clot-busting drug TPA was Mary's best hope for recovery.
Medications that thin the blood can be very risky for an unborn child.
I was more scared with Mary than I was with almost any other stroke patient that I've seen, and I've seen a lot.
You know, you see your wife sitting there or laying there in the bed with her whole left side drawn, you know, it's pretty scary.
I didn't know what was going to happen to the baby, and that wasn't my big concern at the moment, because if she's not here, there's no baby.
The clot-busting drug worked. Mary had a full recovery.
It was the biggest wave of relief that you can imagine.
I got it within 45 minutes of being there, and Dr. Lynch says that is what saved my life. She goes, you have a 3-hour period, and she goes, you know, she just kept telling me, she told me I was an anomaly and a miracle all in one because, you know, I woke up, I didn't have to have any kind of physical therapy or occupational therapy or anything, so.
There are a lot of things that can cause people to have strokes. So if you go through an entire evaluation looking for those standard causes and you don't find them, that's a term called cryptogenic stroke. Fancy term, but basically it means you've got a stroke that's not found on the basis of a normal workup for things that we know are associated with the cause of stroke.
Mary has what they call a PFO, which is a small hole in the septum of the heart in the atrium. Most likely because of her pregnancy, she formed a clot. That hole allowed that clot to go through, and it went straight up into her veins in the brainstem.
Mary was seen very frequently by myself and our high-risk OB doctors.
So Mary was at risk for having another stroke during vaginal delivery because of the particular hemodynamics involved. We felt it was very important that we close the defect to remove that risk. We had to do that while she was pregnant.
It was a long, long road after. I mean, I've been to doctors every week, and I'm just so in awe of everything, you know.
Stroke is such a devastating insult that to see someone come in essentially unconscious, unresponsive, unable to move the left side, have an appropriate intervention be performed, and come back completely to normal is one of the most gratifying situations you can have in medicine. And then to be able to do something that is not even available in many hospitals across the country, especially with the experience that we've had to try to prevent that from reoccurring, that's an outstanding situation to be in, and it's very rewarding and bespeaks the talent and dedication to the neurology team as well as the cardiac team.
That summer, a happy, healthy Nora was born.
Who I say is my miracle child because she came through it. It was the best day of my life.
Stroke. It can happen suddenly, without warning. CoxHealth is the best place to be for emergency stroke intervention. We're proud to be Southwest Missouri's only Level 1 stroke center. Learn more at CoxHealth.com.
Our system sees about 1,100 strokes, TIAs, bleeds per year, which makes us one of the larger centers.
We function as a comprehensive stroke center because we are able to offer any modality of stroke treatment.
We are the only Level 1 stroke center in the region, and so this means that we have staffing 24/7 from the ER through the neurotrauma, et cetera, to be able to provide comprehensive care to our stroke patients.
That means that we have full neurointerventional capabilities, neurosurgical capabilities, and neurological capabilities to treat any type of stroke at our facility.
It could happen any time or place. You feel a tickle in your face. You move your arm feels weak. The words won't come when you try to speak. Folks may think it's all a joke, but it ain't no joke. It's a stroke. Face, arm, speech, time. That spells fast.
Better call 911.
At stroke's first sign. Time means brain, so don't waste time. Time means brain, so don't waste time. Act fast. Face, arm, speech, time. Act fast. Face, arm, speech, time. Act fast. Call 911 before more damage is done. Help is on its way. If you remember what we say, you might save a brain today with face, arm, speech, time. That smells fast.
Better call 911.
At stroke's first sign. Time means brain, so don't waste time. Time means brain, so don't waste time. Act fast. Face, arm, speech, time. Act fast. Face, arm, speech, time. Act fast.
CoxHealth is the region's best at managing brain and spine conditions, earning designations that put us at the forefront of neuroscience care.
I lived with pain for more than 30 years. I worried about what the quality of my life was going to be like down the road.
By age 49, Carl Thanning had injured his back multiple times.
I reached a point where I was actually looking forward to surgery.
The CoxHealth Neurosurgery team repaired Carl's spine damage.
My pain was gone immediately. In 2 weeks, I was walking around better than I had in years.
Inside of neurosurgery, there are several new and exciting treatments. We have at this facility the ability to specialize into the different subspecialties of neurosurgery, so the treatment of skull-based tumors, complex spinal disorders, minimally invasive spinal fusions. The new linear accelerator at CoxHealth allows us to deliver stereotactic radiosurgery not only to the brain, but also to the spinal cord. So interesting and very exciting new technology.
My name is Carl Thanning. I live in Gainesville, Missouri, and I had my surgery 2 weeks ago. Back when I was 18, I actually did injure my back, and I'm 49 now, and so I've had back problems on and off, and sometimes they've been severe, and sometimes they haven't, but they've been livable up to this last year, and then 4 months ago at work, I injured it again pretty bad. But then this last year, like I say now, it got to where it was just severe and it wouldn't go away at all, you know. I mean, it affects your whole life, you know. It affects your family life, your home life, your work life. You're not getting proper sleep, you know, and so it was getting pretty bad, so I knew I had to do something, you know. Basically, the pain got so bad that I was seeing the doctors, and they had told me that I needed to get an MRI done to find out what the actual problem was. And as soon as the MRI was done, which I even saw myself, they showed me some clips of it right there in the technician's office before I left, that you could see the spinal cord was completely pinched off. And so once I saw that, and then also to the degree of pain, I realized that there probably isn't a way around this other than surgery, you know. They had mentioned that, you know, sometimes physical therapy can help in that, but I had already tried all that. And so at that point, I was ready for surgery, and I suppose nobody really ever looks forward to surgery, but you actually reach a point in your life at that point, for me, that I guess I actually kind of did. I said, you know, well, I thought if I am going to have to get surgery, let's do it right now, you know. I'm 49 years old, and while I'd been dealing with back pain for a lot of years, I really wondered, you know, where am I going to end up here? Because, you know, there's thoughts that go through your head that you may end up in a wheelchair, because the doctors had told me, you know, if this continues on, the way the spinal cord's being pinched off, that I could lose use of my left foot, potentially even, you know, do permanent nerve damage in your leg. They could affect your ability to walk. So yeah, there's a lot of concerns there. You worry about, you know, where you might be in 5-10 years or even longer, you know. They sent my doctor sent my MRI over to Dr. Chad Morgan's office. I was referred to him by quite a number of different people, gave him high recommendations, and so he saw my MRI on a Thursday and scheduled an appointment for me to see him the following Monday. And I saw him on Monday, and he expressed his concerns to me that about the potential permanent nerve damage that can be done. And he said, if you're willing to do this, we need to operate as soon as possible. And he actually scheduled me for the operation that same Thursday. And my back is still a little stiff. I have a little bit of pain from the actual surgical area. But as soon as even I came to, right after the surgery, I mean, I noticed immediately the pain in my legs was gone, because it was constant before. And especially I was laying flat, of course, on my back when I woke up from the anesthesia. And well, normally I can't lay flat on my back with my legs stretched out. They have to be bent or, you know, in a recliner or something different. The pain in the legs is completely gone. I've got the movement back in my foot, and I can walk normal again. I'm not dragging my leg. And so yeah, it was, I'm very, very glad that I did it. If I would look back on it now and say that I would have done this years ago if I knew they could bring relief to the leg pain and that. There's no comparison in dealing with over 30 years of pain. I would recommend to anybody to get surgery done if that's what's needed, and so you can move on with your life, you know, and get back to a normal way of life, you know.
We are performing the non-operative and non-surgical treatments of spine and neurological disorders. We primarily see patients with back and neck pain.
My name's Jim Montgomery, and I had a issue with pain in my shoulder that I went to see Dr. Crockett about. Well, I was working out at the time and was just experiencing a lot of pain that wasn't even during the workout time, became to where even just doing tasks around the house or at work became painful. Sleeping became painful. I couldn't put my arm over my head at that time, and so the pain just got worse and worse, and that's what made me go see Dr. Crockett. I'm 48 years old, and as I've gotten older, I just continue to fight the age issue of there is no fountain of youth, and so, but working out and trying to stay fit is a part of that. But my shoulder became a much bigger issue, though, just showing me that I am 48 years old and that I'm not 28 years old anymore, and I had to do something about trying to get it fixed. It was probably 6 to 8 weeks before I went to see Dr. Crockett. After he determined that I had not torn a rotator cuff and I had no other major shoulder issues, then he took did an ultrasound of my shoulder, and was able to determine that there was not a tear, but there was a tremendous amount of inflammation, and he could see that inflammation in the ultrasound. And then he talked to me about trying a cortisone shot to alleviate that pain, to allow the muscle and the tendon to heal. And so we did that. Within about 2 to 3 days, I was starting to feel the effects of the cortisone, and so it started to feel better relatively quickly. So I went in and started doing physical therapy twice a week, and also did it at home as well. And the therapist was able to show me different ways to stretch that tendon and prepare it before I either lift or after I lift, to help keep it more elastic. I'm not for sure exactly what it does, but it was able to give it more movement. The whole process took approximately 6 to 8 weeks. That's why I went to Dr. Crockett, was he specializes in those sorts of injuries and sees that every day, all day long. And when I had access to go see him, that's who I went to see.
The concept of the Jared Neuroscience Center at CoxHealth has really been in the makings for the past decade. It's taken a lot of resources, but now we finally have brought all the different parties together to incorporate really the region's only neuroscience center, where all the different physicians can come under one name, one roof, and have one kind of common mission statement. It's been exciting. We're really excited now that it's finally here. And I think the whole community will see a big change in the way that we deliver neuroscience care.
I think it was a number of people. You know, it was a sign of the times. You know, people were getting away from kind of the ivory tower sort of, you know, we're the best, no, we're the best, no, we're the best. We really have to take the best of the best and bring them together. It's really been the vision or the dream of many administrators and physicians to come together to bring the best together.
So we've moved together. We don't even know what this is going to bring. It's the culmination of a dream, but it's the start of a future.
Thank you for joining us for our community celebration. We're so proud of the Jared Neuroscience Center and hope you enjoy seeing all the services we have to offer.